my name's Leigh Ray. I'm an expert in treating headaches and migraines. Why do the surrounding GPs and dentists and oral-facial surgeons refer to me? I've got a technique that is quite new. The research is still coming out as to why it works, but it does work very well with any type of headache or migraine. It doesn't matter what the trigger is, whether it's hormonally related, stress, dehydration, wine, chocolate, cheese, it doesn't matter what the trigger is. This technique works for 80% of the cases that I see within my clinic. And it works on dampening down, we think it works on dampening down the cervical trigeminal nucleus. So I work on the top 3 neck joints, and they all have feed-forward mechanisms and nerves that go into the brain, into the cervical trigeminal nucleus, that give messages on the neck position. And if they're sending too many messages, that then cascades forward to the front of the brain and gives you a headache. So I just gently desensitise the neck area that's sending that overstimulation or that overload of neural signals to settle that down so that there's not so much extra information going into the brain. I then press on other areas of the top 3 neck joints that also help dampen down the actual referral pattern of your headache. The most common one is usually the one sitting at the back of your head that goes up and over into one eye or both, or across the frontal area. And the other ones that are quite difficult to treat are the temporal pain or the ones associated with menstrual pain because they happen once a month. I usually see my clients for 6 sessions and there's significant reduction in pain, if not all headache is gone. I don't do any cracking of the neck, as this tends to allow the C1, 2 and 3 neck joints to malalign, and we want them nice and neutral so they're not sending that cascade of over-information into the brain. When you crack the neck joints, there is now evidence showing that it can switch off the local muscle system and it makes the neck weaker and less stable. So we want to encourage the neck to be in a more neutral midline, rather than when you sit at a computer or a desk, you're sitting forwards like this, and it's that forward neck position that gives you your headache. So it's very important to get your head back in the centre so that it's receiving all the correct information to the brain and your eyes can function better, and also bring information into the brain to say that you're in the midline and there's not that extra information. I also test your upper cervical ligaments to make sure that you're safe to treat. A lot of people have some damage to these ligaments from car accidents or trauma as a child, falling off monkey bars or out of the back of a car or a ute. And it's very important that your neck is safe to be treated. That doesn't hurt to test, and we write a full letter to your GP or referring doctor, letting them know what we've done. There's very simple exercises that come along in the sessions. They're not hard to do, and you learn how to apply them in your daily life so that you get better and you're able to maintain yourself and stay away from the physio so you don't have any more headaches or migraines. Thank you.